Robotic knee or hip replacement surgery is, instead of using a traditional manual jig, we use a robotic arm that's electronically guided. So the benefit to patients is that it may be a smaller incision, but mostly it's an increase in accuracy, where I know my implants are going to be much more accurate than if I did the surgery manually. Partial knee replacement is definitely an option. It's where we replace one portion of the knee instead of the three components of a knee. It is an advantage in the fact that it's a shorter recovery process and your knee kinematics are much more normal. My patients do like robotic surgeries. They do recover a little bit quicker, and I think it's because of the fact that the implant placement is done a little bit more accurately than with a manual total knee replacement. Regardless of whether the surgery is done with a robotic technology or a manual total knee or hip replacement, our goal is to get you back to your active lifestyle. The most common question I get is who actually does the surgery. I do the surgery regardless of whether it's a robotic or manual surgery. I just use a special robotic arm to assist with my cuts.